Panadol is an analgesic that does not irritate the lining of the stomach and intestines, used to relieve headache, migraine, toothache, lower back pain, sore throat, muscle pain, painful menstruation. Panadol is also used for the symptomatic treatment of febrile syndrome as an antipyretic with elevated body temperature against the background of cold disease and influenza. The drug is intended to reduce pain at the time of use and does not affect the progression of the disease. How to take, course of administration and dosage. For adults, including the elderly, the drug is prescribed 500 mg to 1 grams, 1 to 2 tablets, up to 4 times per day, if necessary. The interval between doses is at least 4 hours. A single dose, 2 tablets, can be taken no more than 4 times, 8 tablets, within 24 hours. Children aged 6 to 9 years are prescribed 1/2 tablet 3 to 4 times per day, if necessary. The interval between doses is at least 4 hours. The maximum single dose for children 6 to 9 years old is 1/2 tablet, 250 mg, maximum daily 2 tablets, 1 gram. Children aged 9 to 12 years are prescribed 1 tablet, up to 4 times per day, if necessary. The interval between doses is at least 4 hours. A single dose 1 tablet can be taken no more than 4 times, 4 tablets within 24 hours. The drug is not prescribed to be used for more than 5 days as an anesthetic, and for more than 3 days as an antipyretic, without a doctor prescription and supervision. An increase in the daily dose of the drug or the duration of treatment is possible only under medical supervision. Contraindications. Children aged up to 6 years. Hypersensitivity to the components of the drug. The drug shall be used with caution in renal and hepatic insufficiency. Benign hyperbilirubinemia, including Gilbert syndrome, viral hepatitis, alcoholic liver damage, alcoholism, in old age, during pregnancy and lactation. Special instructions. With caution and only under the supervision of a physician, the drug shall be used for diseases of the liver or kidneys, while taking antiemetic drugs. In the case of a daily need for taking analgesics while taking anticoagulants, paracetamol can be taken occasionally. To avoid toxic liver damage, paracetamol should not be combined with the intake of alcoholic beverages and should not be taken by persons prone to chronic alcohol consumption. Side effects. At recommended doses, the drug is usually well tolerated. Allergic reactions, sometimes skin rash, itching, quincus edema. From the hemopoietic system, rarely anemia, thrombocytopenia, methemoglobinemia. From the urinary system, with prolonged use in high doses, renal colic, nonspecific bacteriuria, interstitial nephritis, papillary necrosis,